What do contrast agents show in a bladder cystogram? Imagine you're trying to get a clear picture of how your bladder is working and whether it has any issues. When doctors perform a bladder cystogram, they use special contrast agents to help visualize the inside of your bladder on imaging tests like X-ray or computed tomography scans. These contrast agents are dye-like substances that make the bladder and urinary tract structures visible, revealing important details about your bladder's health. Once the contrast dye is introduced into your bladder through a small tube called a catheter, it fills and stretches the bladder. This process helps outline the shape and size of the bladder, showing whether it is normal or if there are any abnormalities. The contrast highlights the bladder wall, making it easier to see if there are any tears, perforations, or leaks. If the bladder has been injured or has a tear, the contrast can escape outside the bladder into surrounding tissues, which appears as extravasation on the images. This is especially useful for diagnosing bladder trauma or leaks after surgery. The contrast also helps assess the bladder's capacity and shape. If the bladder is abnormally shaped or has areas that are enlarged or distorted, it could suggest the presence of tumors, diverticula, or other structural changes. In some cases, the test can detect vesicoureteral reflux, which is when urine flows backward from the bladder into the tubes connecting to the kidneys. This reflux can be identified during the filling or voiding phases of the test and is important because it can lead to kidney infections or damage if left untreated. During the voiding phase, the contrast allows doctors to observe how well the bladder empties. They look for any obstructions, strictures, or abnormal functioning that might interfere with normal urination. Different contrast agents are used depending on the imaging method. Iodine-based contrast is common for fluoroscopy and CT scans because it provides high-quality images and clear visualization of leaks or structural issues. For magnetic resonance imaging, gadolinium-based contrast agents may be used, especially if iodine allergies are a concern, although they produce less attenuation on X-ray images. In the context of bladder health and bladder cancer, a cystogram with contrast helps detect bladder wall defects caused by tumors or trauma, identify structural abnormalities, and evaluate for leaks after surgery. It can also reveal vesicoureteral reflux, which might contribute to recurrent infections or kidney damage. The procedure involves inserting a catheter into the bladder, filling it with the contrast agent, and taking images during filling and sometimes during urination. This process provides detailed information about the bladder's structure and function, guiding diagnosis and treatment. It's important to remember that these imaging tests are interpreted by trained specialists, and results should always be discussed with your healthcare provider. They will consider your individual health situation and determine the best course of action. Using contrast agents in bladder cystograms is a safe and effective way to gather vital information about your bladder, helping to diagnose issues early and plan appropriate treatment. Always consult your doctor for personalized advice and to understand what these tests mean for your health.